there, Dr. Kimberley Wilson from Inspire Physical Therapy, and I want to talk about postpartum today. So first of all, if you have reached the postpartum stage, congratulations. And I'd like to say first, let's just take a moment to appreciate everything that you have been through, everything that your body has gone through. We have grown a human being, and a lot of changes take place during those 9 months as a baby is growing. Your organs, they get all squished in there. Your diaphragm gets pushed way up to make room for the baby. Ribs start to spread out. Your ab muscles get all stretched out. And then we have other muscles that tighten down because they're trying to support all the changes that are happening in your body. Things like your back muscles, they get really, really tight because they're just trying to help you out back there and compensate for everything. Big changes that we see during pregnancy has to do with your posture, right? So baby's growing here, it's throwing everything forward, and our center of gravity changes. So a lot of times, not only is our belly forward, but then our head is forward. And so it really makes some changes in your body. And then all of a sudden you have this baby and things don't automatically go back to the way that they were. It took 9 months to make those changes, and it's not going to go back to normal overnight. But there are some good things that we can do to help support the recovery. And so today I just want to give you 4 quick tips, quick exercises, simple, very effective though at getting your body moving in the right direction for recovery. And I want to encourage you to, it takes time. It takes time to get back where we want to be. It's different for everybody. These 4 exercises that I'm going to show you, they're certainly not prescription exercises for you specifically. And so if you're having some issues that are not resolving, please go see an in-person therapist. Specifically, a pelvic health therapist would be the best option for you in postpartum. But if you feel like you've got some issues that are just not resolving on their own, please go see somebody in person. But in general, these are 4 safe exercises that would be good for just about anybody in the postpartum period. And really, I'm thinking, that 1 month to 3 month window, your body's still doing a lot of healing. You have a lot of responsibilities on your plate. Most likely you are the primary caretaker of this newborn baby that you have. A lot of times we're nursing, so we're the primary feeder for these babies. We're getting up a lot in the night. And so time for self-care is just not there. So you want to make sure that you give yourself a really nice, graceful window to return to activity. And these 4 movements will help to restore just that, like the parts of your body that aren't moving, and we want to make sure that we bring everything back on board like it's supposed to. So I'm going to run through those, and I will kind of talk through some things to think about as you're trying these 4 exercises. So I'm going to slip my eyeglasses off here so I can not have to worry about those for a few minutes. And the first one that I want to talk about really is just breath work. Now the 4 exercises that I'm going to go over, all 4 of them involve breathing of some sort. But this one's just a nice breathing exercise where you can think about your diaphragm, you can think about your ribs moving, and you can think about coordinating the core back into those things. So here we go. So I like to set myself up with a couple of nice blankets, or you can certainly use a couple of rolled towels as well. And so for the bottom one, I want it to be along the biggest part of my ribs. And I'm just going to lay comfortably over that blanket, position one under my head so that I'm nice and comfy. Because remember, my body's still healing from just having had a baby. And so once I kind of find that spot where I feel pretty good, Then I'm just going to focus on restoring my breath, because remember, diaphragm gets shoved up pretty high during pregnancy, and it can get short and tight. So we want to get it moving again. The way that we do that is we get our ribs moving again, because they kind of get stuck in an open position. So we're going to focus just on our inhales and our exhales. Your exhale can really be your sweet sauce for this movement. The more air that you can get out, the more that your ribs will collapse in, and then you will get a much deeper, much better inhale the next time that you take your breath in. So here we go. I like to put my top hand on my ribs just so I can kind of monitor, but I really want to think about just to give you an objective number, about 70% of my breath going into my ribs, and about 30% all the way down to my pelvic floor. So I don't want a ton of air in my tummy. I really want to focus on getting these ribs moving. Absolutely, we're going to get some air into our belly, and hopefully some air all the way down to pelvic floor, because we want to bring pelvic floor back in. It's just gone through a lot too. So a nice breath in, nice and slow, about a 5 to 6 count breath. So here we go. In through your nose. Expand those ribs, and really think about the side of your ribs and your back, because your back's really tight. Or most postpartum moms, their back is really, really tight. So think about that air going into your back. And then we're going to exhale, a little bit of sound. Nice big breath in, expand your back. Let that air go to pelvic floor, let it relax. And exhale. On the inhale, ribs fill up, air goes to pelvic floor is relaxed. Exhale, the air is leaving your body from pelvic floor up. Think about bringing the abs in on the exhale, and relax. And you can do those, think 2 sets of 10, 3 sets of 10, 2 sets of 15, but really the idea is just to start to build those connections again between diaphragm, core, and pelvic floor. These are perfectly safe. And once you do it on this side, roll to the other side. So I'm on my right side, and then I'm going to roll to my left side and do the same thing there, because I want right and left ribs to start moving again and not feel so stuck. Okay? That's my first exercise. The second one is called, sometimes it's called angel wings or snow angels. And again, it's a breathing exercise, but thinking more about the core and how the ribs can really inhibit or prevent the diastasis or the separation in your core from coming back together. We want to think about movement that might pull on that separation or keep it from healing nicely. And certainly ribs is one of the first places that we look for that. So again, you want to get in a comfortable position. You can have a nice towel roll under your head, or you could go a little bit lower to the ground, but I would start with something under your head. I'm going to go just a little bit lower, because I think that's going to feel better for me. We're going to start with one arm first. So we're just going to relax that arm straight out at about shoulder level, or maybe a little bit lower. And I'm going to take my opposite hand and I'm going to monitor this rib. So I'm on the right side. This is my right arm and my right rib, and I'm going to monitor it with my left hand. Okay, and so all I'm going to do is take a nice inhale and exhale. And as I exhale, I'm going to take my arm up as far as I can go without pulling my rib up. And that's going to be a little different for everybody. You might get to where I'm at and you just can't go any farther. And instead of trying to arch your back and bring the rib up to get that extra length, I want you to keep your ribs down and your back flat. And then just bring that arm back down. Breathe again. On the exhale, we're just going to let it slide across the floor and go up as far as you can go. So we're just restoring movement patterns. Ribs down, core engaged, and arms moving. Because as moms, we're using our arms all the time. We're reaching up, we're reaching down, we're twisting, we're turning, and we want the ribs to maintain their position. We want them to be stacked over the pelvis and not continually pulling on our abs as we're healing. So this is a wonderful exercise. Once you've done the right, certainly do the left. Again, monitor it with your opposite hand. Inhale. As you exhale, take that arm up and over without letting your ribs flare up. A progression of that exercise then would to be able to do both arms while keeping your ribs down. So the same thing, you would take a nice inhale. Exhale, bring on your core. Keep your ribs down without gripping too much. And then you would just take your arms up as far as they could go. This might be as far as you can go. And then come back down. And so that would be the exercise, moving through your range of motion. And what you'll find is that that range of motion will increase as you restore the movement patterns, as you start to strengthen the core and engage the core. Then you'll be able to move those arms without affecting the placement of your ribs. So Snow Angels, it's a wonderful exercise. It's safe for most people, and it's just restoring the foundation between your core and your pelvic floor. So great little exercise. And then I like to work on the hips a little bit, getting that psoas, because it's usually a little tight where it's been helping to stabilize during pregnancy. So I'm going to straighten my right leg just so you can see what's going on with my right leg. I'm going to take my left knee and I'm going to bring it up towards my chest. So when I bring my leg up towards my chest, what I feel is it stretches out this right psoas a little bit. If you want it to if you don't quite feel the psoas engaged, you want to squeeze your glutes, and then that will fire the psoas just a little bit more. And then you can also think about really lengthening through that leg. So as if I were taking the heel of my right foot and just driving it toward the wall. And that will really lengthen that psoas. So I'm bringing my knee up towards my chest. I'm lengthening my right leg and feeling it just feels good. It just feels really stretched out through the front of my hip. If this leg feels pinchy in the front, just take it down a little bit lower. But if you're good, you can bring it up as far as is comfortable and relax. And then we're just going to breathe through that. And I recommend 3 to 5 breaths as you're stretching and lengthening the right psoas. Then you take the left leg down, bring the right knee up, stretch out the left, drive that heel toward the wall, squeeze your glutes, pull in that right knee, 3 to 5 breaths through that stretch. Again, you're restoring some movement, restoring some mobility, getting some air in, and coordinating all of those movements and body parts and body systems that need to come back together. They need to work together after pregnancy and in postpartum, but they need a little help waking them up and getting them to do what they do best. All right, now I'm going to get on all fours, so I'll be in the quadruped position. In order to get from this position to that position, I recommend rolling over to your side, pushing up with your hand so that there's not too much stress on your midsection. All right, now we're gonna get into all fours. But to be careful to stack my shoulders above my wrists and then my knees right under my hips. And we're gonna do what's called the cat-cow exercise. I've also heard it called the cat-camel exercise. Doesn't matter what we call it. What we're trying to do is restore some movement in our spine. And so that's what you want to think about, keeping your hips stacked over your knees, shoulders over wrists, and all of my movement is going to come through my spinal column in between those two areas. So I like to start with just, after we get everything stacked and ready to go, we're going to lengthen the spine just a little bit, bring your head up. Take a nice deep breath. We're going to let our spine or our tummy sort of sink in so that we get some extension in our spine. Take a nice deep breath in, and then as you exhale, we're going to come back into flexion. Thinking about just moving through the spine. Continue to exhale. And then inhale. We're going to get that movement going in the spine again. This time I want you to bring your head up as far as it'll go. Good. You're going to feel that in your hips, and your back, and your shoulders. Joints like to be loaded. It's going to feel really nice. Nice big inhale. And then exhale. Movement through your spine. Round. And you can kind of see that my lumbar spine is a little bit flat, so there's some area I need to work on a little bit. But I can focus on that. Just trying to get movement through that lower spinal column. Good. Exhale. As I exhale, I'm thinking about my core being engaged. I'm going to inhale. Move through the spine. And I recommend doing at least 10 of these. So up and down would be 1. And then adding another set. So you could do 2 sets of 10 or 2 sets of 15. Just coordinating your breath, coordinating the spinal column movements.
Here's some information.
And working to get your core, your spine, your pelvic floor, and your diaphragm all working together in postpartum so that your body heals appropriately. And as it's healing, it's waking back up. Things are shifting and moving and getting back into the right positions so that you can build on that and start to do our higher level activities. So the main thing is to make sure that you're taking care of yourself during this time, postpartum, especially those first 3 months. Make sure you're giving yourself plenty of water intake, nutritious food, resting when you can, accept help when given, because you need to be giving your body rest when at all possible. And sometimes that means letting somebody come in and do some things for you, and that's okay. You don't have to be super mom. You don't have to worry about getting the house in order. You don't have to worry about vacuuming, washing clothes, all those things. Like, accept some help for those things and give yourself a little bit of grace, because this first year is going to be busy for you. It's going to be challenging. It's going to have ups and downs. But at the end of the day, as long as you give your body what it needs and you just accept each day for what it is and don't overdo it, then you're going to be just fine. So I hope that you found this video helpful, and I hope you are well on your way to recovery and that this new year brings you all the happiness and joy. You have a great day. Thanks for tuning in. Bye.